Welcome back to KCTV English News. I'm Angel Kim. Jeju Island's ability to respond to an infectious disease outbreak is expected to improve with the establishment of a branch of an outbreak response center and the creation of a department exclusively dedicated to infectious diseases. The Ministry of Public Administration and Security announced that the direct legislation, which promotes the status of the Korea Centers for Disease Control and Prevention, was approved by the Cabinet on the 8th and will take effect on the 12th. As a result, disease outbreak response centers will be set up in 5 regions across the country, including a branch consisting of 10 employees in Jeju. In order to reinforce the response of infectious diseases by local governments, each city's main office will have a task force for infectious diseases. Every city's Institute of Health and Environment will also have a department dedicated to facilitating tests and research of infectious disease in preparation for a surge in volume of tests. The government will also increase staff at national health centers and screening stations. Medical residents nationwide have been on strike since August 21st. Since then, most have resumed medical duties, and 100 of those who were on strike in Jeju returned to work on September 8th. According to the local medical community, 70 residents from Jeju National University Hospital and 30 residents from Jeju Halla General Hospital ended their strike and returned to work on Tuesday morning. With residents of the 2 hospitals on strike for 18 days, medical staff were left with an intense workload, causing some disruption in hospital work. Pyosan High School will select students for the first class to use the International Baccalaureate curriculum at the school. The high school will select 125 ninth grade students from middle schools around Jeju Island. The IB curriculum will begin in 2022 when the newly selected class reaches 11th grade. The high school has been holding admission information sessions from July to October at 45 middle schools on the island. Tests have been conducted to measure the level of residual pesticides in agricultural products distributed across the province, and the results show that all have levels within the suitable range. The Jeju Institute of Health and Environment said they tested 280 agricultural products distributed across the province up until last month and found that the pesticide levels have met the standards. Although residual pesticides were found in 47 products, they were all under the permissible level. The ratio of agricultural products with residual pesticides has decreased from 37% in 2018 and 26% in 2019 to 16% this year. A study has found that Kutjawal, the forest that is considered to be the lungs of Jeju Island, has recorded lower temperatures than other areas of the island. The National Institute of Forest Science said they collected and analyzed the meteorological data from 8 different areas of Kutjawal over the past 7 years and found that the average temperature in August inside Kutjawal was about 2 degrees lower than outside of the forest. The institute explained that this is due to transpiration, the shade effect, and the reduction in reflective heat. They added that although the Kutjawal forest only makes up about 6% of Jeju Island, it has the power to reduce the total temperature of the province if it is properly preserved and managed. Thank you for joining us today at KCTV English News. Please follow us on YouTube at KCTV E! News Jeju and on KCTV's VOD service. Have a great evening.